Wales. So here goes. In 2016, following the closure of the Mother and Baby Unit in Cardiff, Welsh Government allocated funding to each of the health boards across Wales to develop perinatal mental health services. At around the same time, an All Wales Perinatal Mental Health Steering Group and Community of Practice were established, bringing passionate and proactive colleagues across Wales together. Several task and finish groups were established to look at the development of a core curriculum and training framework, pathways, data, and mother and baby inpatient facilities. In 2017, the National Assembly for Wales Children, Young People and Education Committee, chaired by our now Deputy Minister for Mental Health and Wellbeing, Lynn Neagle, undertook a review of perinatal services across Wales. This review led to the publication of a report making 27 recommendations. The report acknowledged the recent Welsh Government investment as a step forward, but also that there was further work needed, particularly around the provision of a mother and baby unit here in Wales. In October 2017, Welsh Government agreed funding for the development of a unit in South Wales, whilst highlighting the need to discuss options for North Wales. And in 2018, the Bumps to Babies report was published, which also made several key recommendations, again reiterating the need for specialist inpatient care. The work to develop Uned Gobaith was led by our Welsh Health Specialised Services Committee colleagues, and together with the All Wales Perinatal Mental Health Steering Group, undertook to consult with individuals who had used services, worked within this area, and who were passionate about the need to build on the work already taking place. It would be remiss of me not to mention the many, many passionate individuals who campaigned, shone the light and shouted very loudly over what probably felt like a very long time. As much as I would like to name everyone involved, if I start to do that, I'm sure to forget someone. So on behalf of myself, the Wales Perinatal Mental Health Network, women and families across Wales, I'd like to take this opportunity to say thank you. Without your persistence and perseverance, we may not be where we are today. But back to 2019, and on the back of the Children, Young People and Education Committee report, the role of National Clinical Lead for Perinatal Mental Health was developed, and I was fortunate to be offered that role. Supporting the development of an inpatient unit, as well as setting up our Perinatal Mental Health Board and re-establishing the community of practice, was set out as our priorities, with our priorities also reflecting the work of the NSPCC Fight for a Fair Start campaign and the work of the Maternal Mental Health Alliance, recognising the need for further investment, early recognition, offering support, and particularly with the parent-infant relationship in mind. Health boards across Wales were asked to express an interest in hosting the unit, and Swansea Bay became the health board of choice to host an interim 6-bedded unit. The development of a steering group was quickly followed by the setting up of a service user consultation group, with myself, Anita Rees, service manager, women with lived experience and colleagues from Action for Postpartum Psychosis attending. Supported by APP colleagues, we set out to facilitate a series of meetings where questions were posed. These included thinking about the location, what the priorities would be for women and their families, and what they felt we needed to consider. The look and feel of the unit, thinking about the communal space, dining and family visiting areas, and how it should operate, visiting arrangements, laundry and cooking facilities. Opportunity was given for those attending to share what they felt worked well and what they disliked. What was particularly poignant, however, was how the views of the artist commissioned to undertake the work within the unit was influenced by the women within the group, coming with an idea of the look and leaving the meeting with a very different set of priorities. The need for calming colours and images, relaxed spaces, soft colours, and the importance of nature. And as we arrive at the end of our whistle-stop tour, the unit needed a name. The group were asked to make suggestions, and Uned Gobaith, Unit of Hope, was a clear winner and so apt. Uned Gobaith, Unit of Hope, a warm, welcoming and safe environment where a dedicated team of compassionate and highly skilled colleagues have already made such a difference to so many women and their families across Wales, holding the hope for women and families when they need it most. Diolch, thank you.